The Connecticut's Hospital Community Service Award is sponsored jointly by the Connecticut Hospital Association and the Connecticut Department of Public Health. Since its inception 20 years ago, this prestigious Community Service Award has recognized the special programs established by Connecticut's hospitals to meet the healthcare needs of their communities. Each year, a winner is chosen for this award from many entries, each describing a program that has contributed to the hospital's community in ways beyond what people think of as typical hospital care.
As Commissioner of the Department of Public Health, I use every opportunity I have to remind people that there are individuals in every corner of our state who have unmet health care needs. I'm so happy to collaborate with the Connecticut Hospital Association to present the 2012 Community Service Award to Bridgeport Hospital and St. Vincent's Medical Center. Together, they have collaborated to create the Hope Dispensary of Greater Bridgeport. Because of you, hundreds of individuals now have the medications they need to manage their chronic healthcare conditions. Thank you for what you've done.
For all the years that I've been in healthcare, I've been in lots of conversations with providers. We've talked about the fact that many patients leave our hospital with prescriptions that they just can't fill. They don't have the money to buy the medications. They don't have any prescription coverage, and as a result, the medicines that they need to get better, they can never get access to.
The concept of the Dispensary of Hope was born in an Ascension Health ministry in Nashville, Tennessee, where someone had the brilliant idea to take unused, soon-to-be discarded pharmaceutical products and collect them in a central depository and redistribute them to people in need. Karen Cinto, our director of pharmacy, heard of this idea and has a passion for serving the underserved and worked diligently to bring the Dispensary of Hope to Bridgeport. The Hope Dispensary of Greater Bridgeport is a collaboration that's made up of the two hospitals in the city of Bridgeport, St. Vincent's Medical Center and Bridgeport Hospital, as well as a number of other providers of primary health care.
Bridgeport Hospital is a member of the Primary Care Action Group, which is a group of all the primary care providers here in Bridgeport that has been working together for almost 10 years now on many issues of improving access to care for the underserved.
In order to open the pharmacy, St. Vincent's Medical Center had to hire a pharmacist, had to get licensed, had to secure space. We did that collaboratively with all of our partners in the Primary Care Action Group, but it took that full collaboration to hire Christine Tony as our licensed pharmacist, to secure the space, and to have it approved by the State Board of Pharmacy.
The people we serve here are maybe a different demographic than we had anticipated. There are a lot more people that are maybe an older group, not yet eligible for Medicare, but have lost their jobs.
The reason we started coming to Hope Dispensary was that my husband ended up being terminated from his employer, where he worked for 39 years. He was out on medical leave, and that expired, and then they stated that all of a sudden they just let him go. I mean, so from one day to the next, we have insurance, and the next day we have nothing. And with his medical condition, it was devastating. We didn't know who to turn to, where to go. But let me tell you, this Hope Dispensary was the biggest godsend.
The Hope Dispensary operates in two ways. When individuals in need of medications first show up with a prescription, we are many times able to fill that first prescription, but we're also able to get them enrolled in the pharmaceutical assistance plans, which ensures their ongoing access to the medications they need to control perhaps a chronic medical condition.
We're going to refill your prescription, but I need to get new information from the manufacturers.
What led me to come here was I went on Social Security, and then the agency on Housatonic Avenue told me that I was on a medical spin down and that I didn't have any more insurance. And I said, Lord, what am I going to do? One of my friends, she said, Sister Maddie, go to the Hope Dispensary. I was hesitant, and then something said, well, how are you going to make it if you don't go?
We've helped over 700 patients and dispensed over $100,000 worth of medication in 1 year.
I came here, and I tell you, they're godsend. I'm telling you, because I didn't know what I was going to do in order to pay for the medication, especially the insulin. It's a blessing. It really is. It's a blessing.